Hi, everyone, and welcome to our virtual open house for the Certificate in Global Tobacco Control offered through the Johns Hopkins Bloomberg School of Public Health. My name is Megan Mingie. I'm one of the admissions officers here, and we're really glad to have you with us today. With me, we have Dr. Joanna Cohen. Joanna, would you like to introduce yourself?
Yeah, absolutely. Thank you, Megan. My name is Joanna. I'm director of the Institute for Global Tobacco Control at the Johns Hopkins Bloomberg School of Public Health. I've been doing tobacco policy research for over 25 years now, and this is a topic that I'm very passionate about, and I'm so excited to be able to talk to you today about our certificate program in global tobacco control.
Thank you so much. And as I said, I'm Megan Mingie. I work with our admissions team here to facilitate the application process for our candidates for the certificate. And I'm happy to work with you to answer any questions you have about the program. Speaking of questions, we will have time for questions and answers for Joanna at the end of our session today. You should see a little question box where you can type your questions throughout today's presentation. Feel free to submit questions anytime, and we'll collect those and ask at the end of our broadcast. So just to talk through kind of the plan for today, we'll start with an introduction to the field of tobacco control, and then we'll move into our program specifically. So some of the program details, what you can expect in the curriculum and classes, how online learning works at the Bloomberg School of Public Health, and then we'll talk a little bit about our faculty as well. And then for those of you who are ready to move forward with an application, we'll talk through the application process, the scholarships that we offer, as well as tuition and financial information. We'll go over admissions requirements and deadlines, and then, as I mentioned, we'll have time for questions and answers. So with that, Joanna, I'll kick it over to you.
Super. Well, let me just start with an introduction to the topic area of tobacco control. And as I said, I've been working in this area for over 2 decades, and I'm still as excited to come into work every day as I was on day one. This is a multifaceted topic that needs input from a large variety of disciplines, and the topic areas within tobacco control are all sort of intriguing, they're challenging, and the challenges and opportunities continue to present themselves, and that's why it's still such an exciting area to work in. The other reason why it's so exciting is that you can really work to make a difference. Tobacco use is the #1 cause of preventable death in the world. So you know that when you're working on this issue, you're really making a difference in terms of public health in your country and globally. The death toll from tobacco products is just it's unfathomable. It's, you know, it's projected to kill 1 billion people in the 21st century. We've already reached and exceeded the expected number of annual deaths from tobacco that was set a decade ago. And we have made a lot of progress, but a key challenge is the tobacco industry itself. So this isn't an area where you just have to solve the technical issues and figure out, you know, a new vaccine or new therapy to help improve health. But in the case of the area of tobacco, you have a multinational, extremely well-funded industry that's fighting you every step of the way. And a big part of what we have to do is understand the strategies that they use and how to combat them. Luckily, we have the World Health Organization's Framework Convention on Tobacco Control. It's the world's first public health treaty, and it has tremendous support across the world, with 181 countries ratifying the Framework Convention on Tobacco Control. And the convention, or the FCTC, lays out the evidence-based interventions that are needed to reduce tobacco-caused death and disease. Another area that has been emerging over the last decade or so is called tobacco regulatory science. And that terminology sort of emanated in the United States because the Food and Drug Administration in the US was given regulatory authority over tobacco products. So the idea of tobacco regulatory science is doing the science, developing, generating the evidence to help inform what a regulatory body like the Food and Drug Administration should do. So that's gotten a lot of play recently, and it's not just the U.S. that has regulatory bodies for tobacco issues. All right, so next slide, please. So there are a lot of different types of careers in the tobacco control field, and we can, as I've alluded to, you can work within your locality or city. You can work at the state or provincial level. You can work within your country, at a country or federal, national level. And you can also work globally, with the Framework Convention on Tobacco Control. There are also lots of global opportunities. The concepts that you learn in this area of tobacco control can also be applied to lots of other public health areas. So we focus on skills including qualitative and quantitative analysis, which are very applied for the area. So it's not just your typical stats course. We ensure that it's applied to making a difference. We focus on strategic communications, writing skills, leadership skills, policy implementation, which is key, and covered sort of the general area of tobacco control as well. What are the key issues currently, what's emerging, and how to stay on top of all that. So there are a range of job titles that you can have once you complete the certificate in global tobacco control. We list some of them here on the slide, but there are many others as well. Next slide, please. So let me tell you about the program itself. This is a one-year certificate program. And the certificate is from Johns Hopkins University, and specifically from the School of Public Health. So you are taking accredited graduate level courses that give you credits from our institution. You take the certificate part-time, and all of the courses are online. You need 25 credits to complete the program, and you do that over 4 terms. So we have a quarter system here. The quarters are 8 weeks long. So you have 4 8-week terms, and each term you take 2 courses. As I've mentioned, the certificate is set up to be very applied. So to give you the skills and the knowledge not just in a theoretical sense, but in a way that you can apply it right away to your work. There is group learning, there are some peer assessments, but everything is skills oriented. Our goal is to provide you with education that equips you with the necessary technical skills to develop and effectively communicate the evidence that is required to support effective tobacco control policy development and implementation. And we do that through the different courses that I will go through next. So next slide, please. All right, so this slide lays out the specific curriculum for the certificate program. There is a prerequisite, which is Introduction to Online Learning. So it's a brief course that will just give you an orientation to how to use the online systems here at Hopkins, so you know where to find things and basically how to use it. There is also a required brief course on academic and research ethics. So that's general for anyone taking any degree or certificate program at the graduate level at Hopkins. So that's something that you will go through as well, and it will serve you well in anything you do moving forward. So the rest of the courses that I'll talk to you about are specific for the certificate program in global tobacco control. So in the first term, which we actually just completed for the current cohort, there are two courses that you take. One is called Global Tobacco Control, and the second is Strategic Communication Planning. So these two courses will give you sort of the foundation that you need to then build on in the subsequent terms. In term 2, so that's in November, December, basically. Again, you take two courses. One is on tobacco regulatory science. So it focuses on how to think about regulating tobacco products themselves. What do you do about the product? What standards might you put in place? How do you make them less attractive and accessible? Those sorts of things. So that will be your tobacco regulatory science course. And then you also take a leadership course, because to be effective in the real world, you need to be a leader. And we highlight the message that you can be a leader no matter where you sit in your organization. You don't have to be the president, you don't have to be the director, anyone can be a leader, and this course will sort of give you sort of the skills and the tools to expand your leadership skills. In term 3, so that would be in the new year, you again take two courses. So one is Quantitative Methods for Tobacco Control. And again, this is more of your sort of quantitative data course, but very applied to help you think through the types of questions you need to ask, how to ask them, and then how to answer them. You'll also take a Writing for Results course to improve your writing skills. So this is a really key area of strategic communication as well as leadership. You have to be able to communicate effectively, and writing is such an essential skill. So we include that course in the certificate program. And then in the fourth term, in the last term, there are also two courses. One is on qualitative methods for tobacco control. So while quantitative methods can are very useful for describing things at the in groups and summarizing what's happening in terms of tobacco use behaviors, knowledge, attitudes, all kinds of things. You can look at associations between constructs. The qualitative methods are able to help you dive more deeply into how people think and in their beliefs, their values, and how they talk about things. So you'll cover things like focus group discussions. So how do you prepare for those? How do you run them? How do you analyze the data? Key informant interviews and observations. So for example, in tobacco control, you might want to go to stores to look at what types of tobacco advertising is happening in the stores. So we cover that type of method as well. And then the last course in the 4th term is implementation of tobacco control policies and programs. As I said before, having the policy and the program is really important. It's takes a lot of advocacy to get those on the books, those policies and programs, but you have to implement them well in order to have the impact that you're hoping for. So the course on implementation is really key. It's that sort of last piece of the puzzle in order to have the public health impact that you're looking for. Next slide, please. All right, so we've worked with the School of Public Health, we meaning, the Institute for Global Tobacco Control has worked with the School of Public Health to develop this program. The Institute for Global Tobacco Control was established in 1998 by John Samet, who has had a long and illustrious history at the Bloomberg School. He's now currently in Colorado, but he's certainly left an important legacy. The Institute for Global Tobacco Control has a mission of preventing death and disease from tobacco products. And we do that by generating evidence to support effective tobacco control interventions. The courses have been developed with the Center for Teaching and Learning at the Bloomberg School of Public Health. There are course activities to keep you learning and engaged throughout the program. And just because it's online doesn't mean that you don't talk to your instructors. So all of our courses have what we call live talks. So those are opportunities for you to get online in real time with your instructor, with the faculty. They'll do all kinds of things, including discussing the assignments, answering your questions, potentially provide some additional content for the course. So the recorded lectures, like the lectures that you will listen to, you can actually listen to them and go through them and learn at your convenience, sort of at the date and time that you want to, although you do need to keep up. As I said, these are 8-week terms. They go by very quickly, so you have to stay on schedule, but it's not that you have to join at a particular time of day. For the live talks, there is a set time where you will be able to interact with the faculty members in real time. There is a 24/7 technical help desk that you can access and other resources to help you with any questions that you may have. Great. So we have amazing faculty that teach these courses. I'm the program director, but the faculty are listed below. Dr. Ryan Kennedy is a professor at the School of Public Health. He teaches the Tobacco Regulatory Science course. Lisa Lagasse is a scientist here and has been doing the qualitative methods for tobacco control class. Fran Stillman also gets great course reviews, and she teaches the Global Tobacco Control course in the first term. Steve Tamplin has been doing leadership trainings for over a decade, and he teaches the leadership course. Kevin Welding has his PhD in economics, but don't let that scare you. He is very clear and practical and accessible in his explanations, and is very good at applying quantitative methods to real world problems. So he teaches our quantitative methods course. And Connie Ho, and I'm not sure if you can see Nasreen Jassani's name, they teach the implementation course. So those are our esteemed faculty. They're all associated with the Institute for Global Tobacco Control. We are a collaborating center of the World Health Organization. The Institute for Global Tobacco Control is also a partner in the Bloomberg Initiative to Reduce Tobacco Use. We work with the Robert Wood Johnson Foundation as well, with the Monday campaigns on some of their programs. We have NIH funding from National Institutes of Health, and we work both domestically and globally to carry out our mission of preventing and reducing tobacco-caused death and disease. So with that, I'll hand it back over to Megan, and I'm happy to take your questions shortly. Thank you.
Well, thank you, Joanna. And as a reminder, you can submit those questions through the questions box on your screen, and we'll begin collecting those now to ask Joanna at the end of the presentation. So I wanted to talk through the application process. Some of you may already be working on your applications, which is wonderful. If you're not, we definitely recommend getting started as soon as possible. We use a system called Sophos Express for the application. We'll have a code you can scan to access Sophos Express just in a few slides. To apply, we require that you have a bachelor's degree from an accredited college or university. So some of you may have studied in the U.S. Many of our candidates have also studied outside of the U.S. So if your degree is outside of the U.S., it would need to be equivalent to a regionally accredited bachelor's degree. So in addition to that requirement, we ask for a current resume or CV, as well as 3 letters of recommendation. And those letters are a really important piece of your application. They should be from professional and or academic sources. So definitely people who know you well and can speak to your interest, motivation, and qualifications to pursue this certificate. You also need to have demonstrated interest or involvement in the field of tobacco control. So like Joanna talked about, this is a very important and vital area of research around the world. We're looking for candidates who are deeply invested in impacting the field of tobacco control positively in the future. If you do reside outside of the U.S., or if you, maybe are of an international background, we would ask that you have proficiency in English. For many of our candidates, we may offer a personal interview to learn more about your English speaking and writing and reading abilities. Obviously, the program's online, so a lot of your interaction will be in written form. So both written and oral proficiency is really important. We actually don't require English proficiency scores, such as the TOEFL, so that interview may take the place of TOEFL scores. And then one very important piece of your application process is your international academic record evaluation. So for the initial application process, you would actually supply unofficial academic records. So what that would mean is a transcript or a mark sheet that shows the courses you pursued at your undergraduate and graduate institutions. They would need to show the degree you received and when you received it. So those are uploaded by you into Sophos Express. If you are admitted to the program, you would then work on the WES credential evaluation process. So that is through World Education Service. We call it WES. It's a credential service where you send your official academic records, and they are processed and reviewed for equivalency, and then a report is sent to the Johns Hopkins School of Public Health. So the initial application process is actually fairly simple, and then we add in that WES credential evaluation component to those who are admitted to the program. And one thing I do want to mention within the application is some important questions that ask you to explain kind of your background and involvement in the field of global tobacco control. Those questions are inside the Sophos Express application, and they are a very, very important part of the application review process. So, we always encourage you to apply quickly, but that is one area of the application where we recommend that you spend a lot of time providing thoughtful responses that show us, your plans, your motivations, how you hope to make an impact in the field. So moving into some financial information about the program. Our current tuition rate is $1,162 per credit. As Joanna mentioned, this is a 25 credit program. All students within our OPAL programs, that's the online programs for applied learning, receive the OPAL scholarship of $446 per credit. So to get the basic tuition per credit charge, you would take off $446 from that $1,162 charge. In addition, we have the IGTC scholarship. So the Institute for Global Tobacco Control offers a limited number of full tuition scholarships each year. If you are applying from a low or middle income country, you're eligible to apply for that scholarship. If you have questions about your eligibility, definitely don't hesitate to ask. We're happy to talk to you individually about whether you qualify. But the main criteria is that low or middle income country residency. So as I mentioned, that's a limited number of scholarships. Those are offered as a part of the admissions process. They cover tuition throughout the course of the program, and they also cover your WES credential evaluation. So really, if you do receive that scholarship, your costs in the program are very, very minimal. Just you would pay like an application fee and perhaps a couple other fees, and that's about it. And other good news about both scholarships, your application to the program also serves as your scholarship application. So you don't need to submit a separate form to apply for the scholarship. You just complete the process in Sophos Express. If you don't qualify to apply for that IGTC scholarship and would like to learn more about other funding that's available, we do have a financial aid office. They can definitely help answer your questions regarding federal loans within the United States. We also have a student accounts team that can talk through your payment options, things like that. So we have support there for you. And our admissions team is also happy to explain any other details about the scholarship itself. One quick thing I do want to note about tuition, we reassess those rates each spring, so tuition is subject to change each academic year. So as I mentioned, the application is already open and many of you have already started an application. We are collecting applications now for our January 15th deadline. I just noticed on this slide we say 2019, but that's actually 2020, so you still have time. So we review, starting January 15th, all applications that are coming through for the IGTC scholarship. So as I mentioned, you'll do that in Sophos Express. All of those application components, including your unofficial academic records, must be submitted by January 15th. I know that that seems like it's kind of far away still, but it definitely comes quickly, and it can take some time for you to get letters of recommendation and your academic records. So you definitely want to get started right now to compile those components. If you are not applying for the IGTC scholarship, so you may be a U.S. resident or resident of another country that doesn't qualify for that scholarship, you're eligible to apply through July 1st, 2020. So you can definitely start the process now, but you do have some more time to submit those additional components. We are accepting all of those applications now for our fall term, which begins August 31st, 2020. So we have one start date each year in the fall. And we are, as I mentioned, working through the application process with many incoming applicants right now. So with that, we do want to go ahead and open up for some questions. I also will mention you can see 2 QR codes on your screen. You can use the camera on your phone to scan either of those. One will give you some more program information, and then on the right where it says ready to apply, that will take you right to Sophos Express. So if you are ready to go ahead and create an account and get things going, you can go ahead and scan that here. You can also see our contact information if you have questions after the session. So Joanna, the first question we have is, how many hours per week do you estimate that people will need to dedicate to their coursework?
Good question. So basically what you should assume is that for every hour of lecture time, so those are the recorded lectures, you need to spend about 2 additional hours on the course. So while the courses are being held, we have around 6 credits, total of 6 credits a term. So that would be, so in addition to this sort of 6 hours a week listening to lectures, there would be another 12 hours that you should plan to do the required readings and do the assignments. So it is a bit of time. There is a significant commitment. That being said, we do get very motivated people who apply for this certificate, and they're working full time, and they sort of fit it in on their evenings and weekends. It is possible, but it does take a commitment to be able to succeed at the courses. These are graduate level courses. So there are, pretty high expectations of you, but of course, you will also get a lot out of it.
Thanks, Joanna. That's really helpful. Along those lines, since the TOEFL is not required, can you give an idea of maybe the level of English writing ability or English listening ability, reading ability that would be expected of candidates in this program?
Yeah, so as I said, these are graduate level courses. So these are courses that master's and doctoral students would take. So we need you, obviously, these are online lectures, so you can listen. You listen to them, you can read the slides. You can also download transcripts. I know for some people for whom English is not their first language, actually reading the transcript is easier than listening to it. So you also want to look at the slides, but you can do that. But you will, that's how the content is delivered. So if you have to be able to grasp the concepts that are being discussed in the lectures. And then your assignments are also are usually in written form. So you have to be able to write at a strong enough level to be able to express your ideas with nuance. That being said, we do acknowledge that for many people, English is not their first language. So we do take that into account in grading assignments. We understand that you're not going to have potentially perfect grammar. However, we need to be able to glean the ideas from what you're submitting. So you need to be able to express the ideas. Having the perfect grammar is not essential. The writing course, they will sort of help you with your grammar, but the idea is more like how to structure written communication, how to present ideas. So you do need strong proficiency in English to be able to really learn and grasp the concepts that are being taught, and then to provide back in your assignments to show the learning that has occurred. But we do take into account when English is not a first language for a student.
Great, thank you. Another question that came in: where does India stand in terms of the IGTC scholarship, and how do we determine overall eligibility for that low and middle income country requirement? So I'm happy to answer, but Joanna, you're welcome to as well if you like.
Okay. Well, why don't you go ahead, Megan?
So we use the World Bank list of LMIC countries, low and middle income countries. We are happy to connect personally with anyone who would like to know if their country's on that list, but we definitely do see applicants from India, so you would certainly be welcome to apply.
Yes, and you would, and currently from India, you would be eligible for the full scholarship.
Thank you. And then a question about the letters of recommendation came in. Should those letters of recommendation be for this program specifically, or explaining the general capabilities of an applicant? So, Joanna, I think you can answer that specifically, and then talk a little bit more about what you might like to see from recommenders.
Yeah, so we're really trying to train people who are well positioned to make a big difference in the future. So ideally, we're looking for reference letters that will, we want to make sure that you'll be able to handle the program for sure, and that you're interested in it. But we also want to try and get a sense that you will be able to use these skills to, as the School of Public Health tagline goes, protect health, save lives, millions at a time. So we want to be able to invest the scholarship in folks who potentially, are in a position or are in a position or have a clear trajectory where they will be able to have a broad impact. So, that's, beyond, let's say, your impact one-on-one with a patient. That's really important work and essential, but that's not going to have sort of the population level impact that we're looking for as we make decisions in a, among the very competitive applicants for the IGTC scholarship. So letters that can address that, sort of your where you sit, your connections, your leadership abilities, what you like, any evidence in the past that you have been able to do that and have a broad impact. I think those are the things that we're looking for. As I mentioned in the regarding the Institute for Global Tobacco Control, we're one of the partners in the Bloomberg initiative to reduce tobacco use. So, you know, if you have a letter of reference from one of the other partners in the initiative, that is also, you know, really helpful because it shows that shows the funders that you have, you know, you're part of a network that can have an impact. So I don't know, does that, Megan, anything else I should address? I think you had a second part to that question.
Super helpful. In terms of specific requirements, I'd say it's always better to tailor to our program. Certainly your recommender can talk about your general strengths, but if they can, you know, it may be good to give them the link to the website to review so that they can determine exactly what it is you're hoping to do with this degree. Someone else asked, how will this program help with career progression or job opportunities?
Yes, I think this will really put you in a good position in job applications to show that you have had specific training in this area and you've received it from the Johns Hopkins Bloomberg School of Public Health. So this is, you know, sort of well, I have to be careful, but I'm a little biased, but this is probably the best training you can get in this area from faculty who've been working in both domestic and global tobacco control for decades. So, so I think having that specific training, and as I said, we do make sure it's very applied to the real world. So you'll so it's not just sort of the theory that you get the practical, so you can get into a job and hit the ground running with the skills that you gain from this certificate program.
Great, thank you. So we also have a couple of questions related to transcripts and academic records. So I'll kind of give my answer, and Joanna, feel free to jump in if there's anything I missed. So one question is, what are unofficial transcripts compared to official transcripts? And then the other question is, do I need to submit all of my records if I have more than one degree? So for that unofficial transcript explanation, as I mentioned, the first round of the application process, so if you're applying for the IGTC scholarship, you start with your unofficial academic records. Unofficial means that you are able to open those records and attach them yourself. Official academic records must stay in a sealed envelope. So for example, if you are ordering your WES credential evaluation, you cannot give WES documents that you have opened and looked at. You would have to have sealed documentation that goes directly from your where you studied to the WES evaluation service. So unofficial records are ones that you as a student have access to and can, you know, scan and upload into your Sophos Express application. Official records are sealed copies that you are not able to access. The second part of that question, do I need to submit undergraduate records if I have more than one degree? Yes, we require that you submit all academic records from anything you took at the college or university level. So even if you maybe completed a few classes at one institution before transferring somewhere else, we would need all of those transcripts. So they can be unofficial for the first part of the application, but we do require all documents. And I will say that is one area where a lot of our applicants kind of get stuck. So if you wait till the last minute to apply and then you submit your records and we discover that a college is missing, it can really take some time for you to go back and obtain those records. So the best possible thing you can do is to apply now, submit your records now so that we can review everything and make sure all documentation is complete before the deadline. Joanna, anything to add there?
No, I think that was great, Megan.
Thank you. So someone asked a really good question about kind of your background coming into the program. So I look forward to making a difference in the future. Is it absolutely necessary to show a background working in the field of tobacco control? So basically, can I apply if I don't have work experience in my past?
Yes, absolutely. You can definitely apply, and and you will be able to benefit. So there are, we don't expect a lot of people who are working in the area haven't really had the specific training. So the courses, don't expect you to have a full understanding of the area at all. And there are lots of resources for you. That being said, so the program is for anyone. You don't have to have previous experience. Where the work experience or ability to make an impact comes in is specifically just for the IGTC scholarship for people in low and middle income countries. So I hope that was clear. So that doesn't, if you want to apply and take the certificate, that's absolutely fine. The issues about, being well positioned to have an impact in the nearer future is only for candidates for the IGTC scholarship.
Great, thank you. What countries do students come from?
Lots of countries. The US, and we've had India, Philippines, Vietnam. We've had China in the past, Brazil, Mexico. Just trying to think. We've had, I think, Ukraine. I'm not sure if we've had Turkey. Carla's on the line. Carla's the program director.
Yeah.
She deals with, is there anyone else, other countries that
Yeah. Currently for this year, we have some students from Bangladesh, Kenya, Guyana, Malaysia, Guatemala, or some of the other countries, just to add on to other countries you had already mentioned, Joanna.
Excellent. Thank you.
Yeah, thank you both. Are there textbooks in the program?
Carla, are there textbooks?
So I know for the writing course, the workshop course, there was a book that was offered online, but not like a physical textbook. But those links to those resources are in the online course syllabi and materials for students.
So that's online. I believe the vast majority of the courses do not require you to purchase any textbooks, that the materials are online. Steve may provide people with a book for leadership potentially, but the materials, so we use a learning management system called Course Plus, where you, for each course, that's where you submit your assignments, and it has sort of the syllabus and the readings for the course. So almost, I think for all the courses, everything is available to you online through the Course Plus site.
Great, thank you. So it seems like questions are slowing down. We do have a few more minutes, so if you have more questions, feel free to go ahead and submit them. One more that I have is, how many students do you accept each year into the program? And also, I'll add on because we get this question a lot, specifically for the scholarship, how many do you admit?
It's for the scholarship, it's flexible. We have, let's say we have about 10 slots for the scholarship, so it is quite competitive, but there are 10 good slots. And then for the non-IGTC scholarship, as long as folks meet the requirements for the program, that's what we're, so there aren't hard limits on the number of folks that can be accepted into the program.
Great, thank you. It looks like this may be our last question. Is there a specific type of academic background or degree that you're looking for to apply to the program?
Yeah, absolutely not. I think, tobacco control is such a multidisciplinary area, and folks from all kinds of disciplinary backgrounds have a lot to contribute to the field. So, and we are very open to what people can bring. So there's not one degree, there's not 5 degrees, there's, people can get, can get to their journey from all different directions, and we are very open to how you've gotten to where you are now. So we just feel that there are many, many ways to contribute, and as long as you are interested in learning and studying this material, we're happy to have you.
Wonderful, thank you. Well, we really appreciate everyone's attendance today. Thank you to Joanna and Carla for answering all of our questions and talking through the program details as well. If you're attending the webinar today and have additional questions, don't hesitate to give us a call, or you can see my email address is on the screen as well. We will also be reaching out in the coming days. So if you submitted a question that maybe was a little too specific for your situation, then we're happy to connect with you and help answer that question for you as well. So Joanna, would you like to give a farewell to our attendees today?
Yes, so thank you so much for joining us today, and I really look forward to seeing your applications. And please reach out if you have any questions whatsoever.
Yes, absolutely. All right, well, thank you, everyone. We hope you have a wonderful day.
Bye-bye.